Welcome. In this video, we are going to discuss about LD50 and radiation syndromes. LD50, this is lethal dose 50. In the context of the radiation exposure, LD50 refers to the amount of radiation required to cause death in 50% of an exposed population. It is used to estimate the lethality of radiation at various doses. LD50 for radiation is often expressed in the units of Gray, which is measured of observed radiation dose. For human, the LD50 for radiation is typically 4 to 5 Grays, that is 400 to 500 rads, for the acute whole body exposure, meaning that the dose in this range would cause death in 50% of the people exposed to it within a certain period, for example within 30 days, even with medical treatment. What are the factors influencing LD50 for radiation? The first one is dose rate. The rate at which the radiation is delivered plays a role, and a high dose over a very short period, like from a nuclear explosions, is more lethal than the same dose spread over a long period. For example, like occupational radiation exposure, those who are working in that environment. Then depending upon the type of radiation, different types of radiation like alpha, beta, gamma or neutron have different biological effects. Gamma and neutron radiation, which are highly penetrating, tend to be more dangerous in large doses. Then it depending upon the individual sensitivity factors like age, sex, overall health and genetic factors can influence an individual's sensitivity to radiation and their chance of survival. Then medical care, prompt and effective medical interventions can improve the survival rates even at doses near or above the lethal dose 50, that is LD50 threshold levels. How the LD50 is used? So LD50 for risk assessment. The LD50 value helps estimate the risk of populations exposed to radiation in various scenarios such as nuclear accidents, medical radiation therapy or environmental contamination. Treatment protocols. Understanding the LD50 will help guide decision about medical treatments following radiation exposure such as bone marrow transplants or the use of other therapeutic interventions to reduce mortality. Regulatory standards. LD50 data can influence safety standards and radiation protection measures both in occupational settings and in emergency response plans. The LD50 concept provides useful way of understanding and quantifying the severity of radiation exposure and its potential to cause fatalities. It also helps in determining the amount of radiation exposure that would lead to widespread health impacts in a population. Now let us discuss about the radiation syndromes. Radiation syndromes refers to different groups of symptoms and health effects that result from acute exposure to high doses of ionizing radiations. The specific symptoms and severity will depend upon dose of radiation received and part of the body which it is affected. There are three main radiation syndromes: central nervous system syndromes, gastrointestinal syndromes and bone marrow syndromes. Each of these syndromes is associated with different levels of radiation exposure and also have varying degrees of impact on the body. Let us see the central nervous system syndromes. The central nervous system syndromes occurs when the radiation dose is extremely high, typically above 30 Gray. This is one of the most severe forms of radiation sickness, leading to rapid failure of the central nervous system. Earlier stage, that is immediate symptoms, may include confusion, loss of consciousness and sense of disorientation. Next, it will lead to neurological effects. The individual may experience seizures, ataxia, that is lack of muscle coordinations, and altered mental status. Then the severity increases within hours to few days. Individual exposed to such high doses typically experience death due to the failure of the central nervous system and loss of brain function. Pathophysiological conditions. So, high doses of radiation cause widespread damage to the brain, including destruction of nerve cells and blood vessels, leading to increased intracranial pressure and systemic failure of brain functions. The syndrome is typically fatal within 1 to 3 days of exposure. Next, let us look at gastrointestinal syndromes. So, the gastrointestinal syndromes typically occurs after 6 to 30 grays of whole body radiation exposure. The gastrointestinal system, particularly the cells lining the digestive tract, are highly sensitive to radiations, and their rapid turnover leads to severe damage. What are the early stages? Nausea, vomiting and diarrhea within hours of exposures, and progressive stage as radiation continues to damage the digestive tract, severe abdominal pain, dehydrations, electrolyte imbalances, and also intestinal bleeding may happen. So, if the dose is high enough, death can result from dehydration, shock and infections, typically occurring within 3 to 10 days after exposure. The pathophysiological conditions. The small intestine is particularly vulnerable because of the rapid turnover of epithelial cells in the intestinal lining. Radiation damages these cells and impairing the nutrition absorption and causing leakage of bacteria into bloodstream, which can lead to sepsis. The death of gastrointestinal cells leads to severe fluid loss, infection and organ failure. Supportive care is essential, such as fluid replacement, antibiotics to prevent infections and treatments to control symptoms like nausea and pain. So, the next one is about bone marrow syndrome. Bone marrow syndrome occurs after exposure to 1 to 10 gray of radiations. So, the early symptoms: nausea, fatigue, mild fever and the hematopoietic failure. The increase in symptoms may hematopoietic failure as the bone marrow is damaged. Decrease in blood cells leads to symptoms such as anemia, fatigue, shortness of breaths, leukopenia, increased risk of infections, and thrombocytopenia, bleeding or bruising. Severe symptoms: if the dose is high enough, bone marrow failure results in life-threatening infections, bleeding and anemia. Death can occur within weeks if the individual is not treated. So, some of the pathophysiological conditions of the hematopoietic stem cells in the bone marrow, that is radiation damage to the hematopoietic stem cells in the bone marrow and reduce the production of the blood cells, and bone marrow failure, so which leads to death in a weeks unless the stem cell transplants and blood transfusions are provided. So, this is a severe disease syndrome. So, in summary, there are 3 syndromes: central nervous syndromes, gastrointestinal syndromes and bone marrow syndromes. Central nervous system syndromes, dose is greater than 30 gray, and gastrointestinal syndromes, it may lead to 6 to 30 gray, and bone marrow syndromes may cause between 1 to 10 gray. Thank you for watching.